You have to tell me all the markers of lung tumors or cancers that we have. Before I go on to this, can you tell me which is the most common lung malignancy? Which is the most common lung malignancy? Let me ask you a question before you start getting into that mode of ratta in your life. Yes, so most common malignancy, many of you said adenocarcinoma. Bhul gaye this trap. It's so easy for me, you always fall for this. Many of you didn't, and I'm very happy. But the most common lung malignancy is none of these. The most common is metastasis, usually a breast cancer coming to the lung or some other cancer coming to the lung. If mets is not there in the options, then I agree with your answer that the most common out of these is adenocarcinoma. Now let's come to the real deal. You have to tell me markers. So for squamous cell carcinoma, we have all PP markers, P40, P63. FMG exam में पूछा था, out of P40 they went to that depth of this question, which is the best marker. P40 is the best marker for squamous cell carcinoma of the lungs. Now coming to adenocarcinoma, A for adenocarcinoma, all AA and 1 wale markers like napsin A. For adenocarcinoma, A is the first alphabet, so MUC1 for adenocarcinoma, TTF1 for adenocarcinoma. Now coming to small cell carcinoma, sounds like an innocent small cell, but I always called it chota packet bada dhamaka, which means it sounds like a chota packet small cell. But now the list that I'm going to show you, may God save you. First set, it is divided into two lists. First list is all the in synaptophysin, chromogranin, bombesin. Pehle to in wale markers. Then the next part of the list is all short forms in one place. NSC positive, CD markers like 56, 57 positive, and last year ka INI-CET question, which is the nuclear marker for any kind of small cell carcinoma. You know, that time student, ये तो बिल्कुल ही googly question था INI-CET का. No one, even for an MD level student, you give this question and he or she won't be able to answer it. So this was something which everyone had to take a guess. And students being our students, my students, decided, अच्छा इंट्रा न्यूक्लियर मार्कर पूछा है तो INSM मार्क कर देते हैं, बिकॉज उसके नाम से ऐसा हम निमोनिक मैम एग्जाम में बैठ के बना के आए कि INSM साउंड्स लाइक इंट्रा न्यूक्लियर, तो दैट मस्ट बी द इंट्रा न्यूक्लियर मार्कर. एंड somehow it worked in their favor. I mean, the full form is not intranuclear and you don't have to know the full form, but sometimes when you take that safe, or you just take a random guess, but that's how you've been studying and probably the universe works in your favor, this is exactly how things go. So the intranuclear marker out of this is going to be INSM. So first you have in, and then you have all the short forms. This is all for small cell carcinoma. Now this last question is only for NEET PG students, not FMG students. Mesothelioma का marker कौन सा है? Mesothelioma का new marker आया है, that is calretinine. Somehow I have noticed as soon as I say ये नहीं याद रखना, like in FMG students I'm telling you ये नहीं important, somehow this is what you will definitely remember. That's unfortunately how our human brain works. So calretinine for mesothelioma.